Hello friends, welcome to Science Diary by Shalini. Today we discuss about the tuberculosis disease. It is a bacterial disease. So now we learn about this disease. It is commonly called as TB. It is a very serious disease. About half a million people die of this disease each year in our country. It's mainly affect the lungs. The germ that cause tuberculosis are the types of bacteria. It is caused by a rod-shaped bacteria that is known as Mycobacterium tuberculosis. Third point is it commonly affects the lungs where small tubercles are formed, but many attack any part of the body including the brain. World TB Day is celebrated on 24th March. Tuberculosis spread easily where people gather, crowd, or where place live in crowded condition. People with HIV or AIDS and other people with weakened immune system have a higher risk of catching tuberculosis than people with typical immune system. Types of tuberculosis. How much types? These are two types. First one is a pulmonary tuberculosis, second one extra pulmonary tuberculosis. Now discuss about the pulmonary tuberculosis. It is an endemic infection affecting lungs and it is further classified into a, primary tuberculosis, pneumonia and B1 is a military tuberculosis. Primary tuberculosis pneumonia symptoms included coughing and high fever. High fever it can also arise a patient with HIV or AIDS. Number two is military tuberculosis. This form of TB is named so because of a distinct pattern seen on the chest radiograph, where many small spots distributed throughout the lungs, field bearing an appearance similar to millet seeds. The infection can eventually spread to the extrapulmonary organs such as the spleen, liver, and kidney. WHO is on 1983 declared as global welfare latent tuberculosis infection. This infection is mainly in those patients having the bacteria with their body but do not display any of the symptoms of the disease. This infection is primarily detected through the tuberculosis skin test. Now, we discuss about the extrapulmonary tuberculosis. It is usually seen in immunocompromised patients. There are severe types. Tuberculosis meningitis, also known as TB meningitis or a tubercular meningitis, is a specific type of bacteria meningitis caused by Mycobacterium tuberculosis infection of the meaning the system of membranes which envelop the central nervous system. Osteotuberculosis. When tuberculosis spread to your bones, it's known as a ostal or a skeleton tuberculosis. Now, third point is renal tuberculosis. Renal tuberculosis is a form of tuberculosis that affects your kidneys. Left untreated, it can cause serious complications, including kidney failure. Fourth point one is lymph node disease. This disease is a systematic disease which may give rise to cervical lymph adenitis is an extrapulmonary manifestation of the disease. The most usual signs and symptoms are the appearance of chronic painless mass in the neck, which is persistent and usually grow with time. Fifth heading is adrenal tuberculosis. That is a fifth type of adrenal tuberculosis. Mycobacterium tuberculosis complex spread to the adrenal glands hematogeneously. Clinical manifestations may take years to become apparent and asymptomatic infection is not uncommon. Adrenal involvement was found in 6% of patients with active tuberculosis in an autopsy series. Diagnosis of tuberculosis. How to diagnose tuberculosis disease? Apart from all the physical test, other test is available to diagnose the presence the infection bacteria. These tests included certain body fluids test, bloods and sputum skin test, and chest X-rays. Number one is a blood test. In this type of procedure, samples are blood collected and tested in the laboratories for the pressure or absence of TB germ in the blood cells. Skin test. It is the most common type of test. In this procedure, a small sample of tuberculin, a purified protein, is infected under the patient's skin. If the skin around the site of infection gets swollen more than 5 millimeters, it is clear indicator of TB infection. Symptoms of tuberculosis. TB bacteria or Mycobacterium tuberculosis multiply over it gets into the lungs. It can cause several symptoms such as number one, coughing up blood and mucus from deep inside the lungs. Number two, a bed cough that lasts 3 weeks or 1 year. Number three, weakness or fatigue. Number four, sweating at night. Number five, pain in the chest. Number six, weight loss. Number seven, chills and fever. These are the symptoms are seen in tuberculosis disease in any client. Causes of tuberculosis. Infants and senile individuals are at a higher of catching TB infection. Number two, individual with a weak immune system, aerial increased risk. Number three, metabolic disease such as a diabetes can also increase the risk of contracticity of TB. Number fourth, tuberculosis is a contagious airborne disease which can acquired from close contact with an infected person. Number fifth, Mycobacterium tuberculosis is one other readily. It is a pathogenic vectorial species and mainly comprises for other type. TB causing bacteria, namely Bacterium boris, Mycobacterium canti, Mycobacterium mirrors, and Mycobacterium Affinism. Number 6. Some form of TB bacteria have become drug resistant. This means that drugs that once cured the disease no longer work. Now, treatment of tuberculosis. Drug treatment is one of the most effective way to treat this infection disease for patients with latent TB infection. Number two is doctors generally prescribe an antibiotic called ionized presenting the indent infection from bearing achieved. Achieved TB disease will be deadly is left untreated. The procedure involving is taking a combination of ethambutol, NH, prifetine and pyrogenidamide for a term of 3 months followed a mix of nitrogen and pyrogenidamide of 12 months as a medicine. In countries where tuberculosis is a common, infants often are vaccinated with the Bacillus calamite gurion BCG vaccine. This protect infants and toddlers who are more likely to have active TB disease in the fluid surrounding the brain and spinal cord. Now, a transmission of tuberculosis or a TB. TB is spread from one person to next through the air when people who have active TB in their lungs cough, spit, speak, or sneeze. Most common TB drugs that's name are mentioned here. It's the last point. Number one medicine is isoniazid. Number two, rifopin, also called as rampactin. Number third medicine is rifabutine or a mycobutine, rifapentine or a prifetine, and pyrazinamide. And fifth, last one medicine is name is ethambutol and or a myamibutol drugs can take in tuberculosis disease. So now this is about the tuberculosis disease and cures and its types. So now if you are like this, you now